I'm here with Dr. Natalie Sampson, and thank you for joining us, Dr. Natalie. I'm so happy to have you.
Happy to be here.
I appreciate you taking the time. I know you're super busy with your office in Calabasas and seeing patients, but I also want to hear a little bit about your the new business that you're starting too, if you want to share a little bit about that. But I want to introduce you and have you share about yourself and tell us about your practice, what you do, and kind of your journey of getting there.
Okay, so I'm a physical therapist. I have a doctorate in physical therapy, and I have a private practice in Calabasas, California, and we primarily focus on orthopedics. And I also have a Pilates and yoga studio. But what I find is in orthopedics, working with the low back and SI joint issues, we also end up treating a lot of pelvic floor issues because they tend to refer to low back pain. They present as SI joint pain. So I do treat a lot of moms, a lot of new moms for various what seem to be orthopedic in nature, but actually we find a lot of things stem for the pelvic floor. So, yeah.
That's really interesting. And I bet there are a lot of people who don't realize that, a lot of women who don't realize that. And yeah, very interesting. As a Pilates instructor, and I had the privilege of working with Dr. Natalie in her office as one of the Pilates instructors, and I loved it. She had a great facility, but also I know that she knows her stuff. So so that was awesome. And I got to train Natalie too. I got to be her Pilates instructor.
Oh yeah.
That was fun.
That was awesome.
So what I was going to say was most of the people that come to me, or the majority of the people I see say, come in and will complain of low back pain. So it all stems from something. So we'll get into that a little bit more. But tell us, so you have your doctorate, and I know where you went to school, but tell us about your path, how you got into physical therapy and that sort of thing, where you went before you got your doctorate.
Yeah. So before I got my doctorate, actually, I was, you could say, an at-home mom. I had 2 young boys, and I was just taking classes at a local junior college, and started getting into anatomy and physiology and biology, and just learned that I really loved it. So I just kept pursuing that path, and one thing led to another. My best friend's a speech pathologist and said, I know the perfect, occupation for you. It's called a physical therapist. At that time, I didn't even know what a physical therapist was, researched it, did some volunteer work, and then the rest is history. I took some prerequisites and transferred over to USC, and there I was a exercise physiology major. And I went there specifically because I knew I wanted to go to their DPT program. So then shortly after that, I did get accepted to the USC's Doctor of Physical Therapy program. And at that point, my first year in, I was pregnant. So I had my 3rd child, and all 3 by C-section. So the benefit of that was I had my last final on a Friday, and then scheduled my 3rd C-section the following Monday. So the timing was perfect. It was challenging, but yeah. So
yeah, I love that story. I love it. And I remember you sharing that with me before, part of that before, because at the time I was considering going to USC to study to be a physical therapist, and I had also worked in another clinic with USC graduates, physical therapy graduates, and it's a phenomenal school. I worked with some really amazing PTs, and those prerequisites are a killer, and that's what those prerequisites did it in. And I thought, as a mama, this is what inspired me too about Dr. Natalie, was that as a mama of 3, which I was as well, going through PT school, I thought, okay, if she can do it, I can do it. And then I realized that wasn't quite my path. I love physical therapy. I think it's so helpful, and I love that you're including Pilates in your facility to in addition, because it's an amazing complement and for post-operative care. But I found my path. So
yes, you did, and you're amazing.
So thank you for sharing that. And like you said, you had 3 C-sections. So I think we should dive into the C-section, you know, what it does to mama's body and how we can rehabilitate that. I know personally Pilates has been amazing for me. I happened to be having my 3 daughters at the same time of being introduced to Pilates, and it was really helpful because with my twin daughters, I was on bed rest for 2 months, so I was really atrophied. My body was atrophied. But prior to that, I was dancing up until my 7th month, so I was pretty active.
Yes.
And then 2 months on the bed rest, it really took its toll on my body, and then, of course, the C-section. And then 2 years later, I had another C-section, almost 2 years later. And at that time, I started, it kind of sounds like you, I started my Pilates teacher training course, did a full week, had my C-section, delivered Ava, took a week off, and then came back the next week to complete my, continue on with my Pilates training course. So coming back after a C-section, you know, trying to do the exercises, it wasn't quite the same. You couldn't really, and I couldn't really do it. I couldn't complete the exercises really. So,
right.
So,
nor should you. At that point, that soon, yeah.
It was soon, and it really wasn't a good time to go back. But I knew being there, I needed to be there.
Yeah.
And if I could see the motions and learn the anatomy and that sort of thing, then I could get it eventually. Although I still felt unsure of myself, so I went through a second Pilates teacher training course, a master course, shortly thereafter when I was a little bit more, a little stronger and rehabilitated, so I could really get it into my body.
Yeah.
Because that's the thing, you really have to feel it so you can kind of describe it to people too and teach it to people.
Absolutely. Yeah.
So what I learned from my hospital reports, because I did get my surgery reports, I don't know why I did. I don't know if that's a common thing, but I did. And so I read them.
Typical, but it's good that you did. You were probably curious and wanted to find out what happened to your body.
Yeah, I was. So what I found was what it says, I remember, that they blunt cut through the rectus abdominis, which is the top layer of the abdominals. Most people call your 6-pack abs. That's what I always tell people and my clients. And they kind of rolled them up and clipped them so that you could go through the other layers.
Right.
Now, okay, so we're going to get into anatomy here. So you've got the rectus abdominis, which is the top layer. And then you've got your internal and external obliques underneath that, correct?
Yes.
So are those spread apart or are they cut through? I think that they are cut through as well together.
Part of those are cut through as well. Yeah. There's actually 8 layers that are, of tissue, abdominal tissue that is cut through, including your uterus. But I'm probably a little bit ahead of you. So go ahead with your op report. So then cut through there and
and then
move everything out of the way.
Move everything out of the way. So you've got your organs, right? Yeah. All the organs are out, and then they cut through the uterus to get the baby out. Right? Did I skip a step?
No. Okay. Yeah, they're moving your organs, your bladder, your intestines. Yeah.
Which is so wild. And then I remember them saying, they wanted to make sure you use the restroom before you left, so they've got everything in place and that everything's working properly and that sort of thing. And so there's a lot going on, and I just get this picture in my mind of people thinking, a C-section is it is a common thing, but I think people aren't understanding the how big it is. Like, it is a major abdominal surgery.
Yeah.
And with any other surgery, you're going to be sent to physical therapy to rehabilitate.
Right. Yeah, that's true.
And what I'm finding is with my clients, and the more and more I work with mamas, is nobody's getting any rehabilitation care or even suggestions of how to rehabilitate.
Right. Yeah.
And so that's what I'm hoping to kind of teach women and teach mamas is how to do that and rehabilitate. And I surveyed about 130 women, a little bit more than that, and asked them, like, did you get any care? What was it? And people from all around the world. You know, I think if you want to have a baby and you want to get care, go to the UK or Australia.
Oh, nice.
Or Canada. I think Canada,
right.
you get some care, you get a year maternity leave. So I want to go back to what you were saying as far as your patients coming in saying, you know, they have SI joint issues or low back issues.
Right.
And that's stemming from either the abdominal surgery or the pelvic floor vaginal deliveries. Because we can talk about, and you can go ahead and talk about vaginal delivery, what we were talking about before with the pelvic floor kind of expanding and what that does.
Right, right. Well, you know, first of all, with C-sections, that's a good point in terms of it being a major surgery, but no rehab prescribed or required after. And typically, you know, what happens is, and as you know, once all of those areas are all sewed back up together, and then you get your nice little staples and your uterus is massaged, which is really painful so that it goes back down to size. It's really painful to stand up straight. So, and then typically afterwards you're bent over. So, you know, you'll get low back pain typically. And then on top of that, you've got this little bundle to carry around. So, you know, after, obviously, I mean, it's good to walk and to keep your bowels regular. That helps to keep your bowels regular. It depends also on if you're somebody who was able to exercise all the way up to that point of birth, or someone like you who's been on bed rest. You know, you should be doing some kind of rehabilitative thing after like the 6 to 8 week period after you're really healed. During that first 6 to 8 weeks, though, you do want to walk as much as you can, as much as your body will allow you to. And, you know, the ways to know that you've done too much is sharp shooting pains, abdominal pain, contractions of those, you know, the uterus will also contract, which is a good thing, but sometimes that can also lead to muscle spasm. And then, you know, if we were lucky enough to have gone to a physical therapist, you'd learn some gentle stretches, you know, opening up your hip flexors, some gentle stretches for your low back. And also knowing if you're breastfeeding that all of those hormones are raging through your body, so you're still really lax. So this is also a time for all of us, C-sections or vaginal birth, if you're breastfeeding, to know your precautions. And everyone's different. Our alignment's different. And so, you know, I am a proponent of people just going in and just getting an assessment afterwards with a physical therapist and getting just some basics, you know, for exercise. And then also knowing whether or not you're able to contract that pelvic floor, you know, again, whether it be vaginal or C-section. With vaginal births, you know, it's really common to have urinary incontinence, even fecal incontinence, not able to hold your bowels. And so pelvic floor strengthening before and after birth, you know, a lot of women are taught before birth to do that, not necessarily afterwards, and then throughout your lifespan, because these muscles naturally, you know, they atrophy over time. And then what I find, so typically it's a woman who comes in my clinic not very soon after birth. Usually it's after her baby starts to get bigger, like around 6 to 9 months. They start developing, you know, low back pain that they've already had. And it's just getting worse because their child's getting bigger and then they have a bigger baby to carry. We get neck pain, shoulder pain, wrist pain, especially if you've had a previous injury, and then that SI joint pain from hanging the baby, you know, over on one hip.
Yep.
And then, so as we start to ask more questions, the first thing we ask about is, you know, how often do you urinate? Do you leak when you sneeze, cough, you know, those types of things. And that gives us an indication of, you know, is this a disc herniation? Probably not, you know, maybe a disc herniation, though, that's aggravated by pelvic floor weakness. Yeah. And then so from there, we teach our clients how to contract their pelvic floor. A lot of times they don't even have a feeling. They're not connected with their pelvic floor. And that's where Pilates comes in. Pilates is amazing. Pilates actually inherently has movements within it that get your pelvic floor to contract, on a subconscious level, which is really how it should contract. Yeah. So there are lots of studies that have shown that even before you lift a load or lift your baby, automatically your pelvic floor and your abdominal muscles, all of your core muscles contract milliseconds before you lift that load. And so that's an automatic thing that should occur. And a lot of times after a chronic low back pain, for whatever reason, those muscles shut off in the low back and the pelvic floor. Wow. So I know I could go on and on. Yeah.
That's very interesting. Shoot, now I just lost my thought. So it'll come back to me.
Yeah. So
go ahead.
So I mean, I could go on and on with what happens, but I guess some take home points are, if you're planning on having a baby or getting pregnant, the more physically fit you can be beforehand, the better. Obviously during pregnancy, you want to keep your pelvic floor strong, but you also want to strengthen your upper body too. Strengthen your posture and your upper body, because eventually you're going to be holding this little bundle. And I see a lot of patients that come in with a lot of kind of pain around their shoulder blades that will radiate up to their necks, if that's not taken care of. Even during pregnancy, a lot of times the intra-abdominal pressure can refer to the shoulder blade. There's a lot of that. And then also the SI joint and low back. So there's just a lot that can be done. You don't have to live, the take-home point is you don't have to live with that. If you cough and sneeze and you're losing urine, that's not normal. Not even after menopause, there's a lot that can be done. So,
that's good to know. I know when you say that, it's not the way it has to be. It can be taken care of or prevented. And I feel like so many moms kind of have this thought that it comes with the territory of being a mom, and these things, it's just what you kind of go through. That's what to be expected as a mom. And those are the things you kind of, you're happy to take on because because you're a mom and you love the baby so much. But really, we have to be able to take care of ourselves so that we can be more present and more available and not in pain. And we shouldn't have to live with pain. We don't have to live with pain.
Right.
And I when you were talking about the SI joint, I remember seeing this picture of the skeletal body and with someone either holding a baby or either having a backpack or a purse on one shoulder.
Right.
And what it does to the pelvis, and it shifts. And you can see what it does when the pelvis shifts, what it does to the SI joint, what it does to the spine, and then what it does to the shoulders. And you can see in women, too, who carry on one side. You could totally see it on their shoulders and in their pelvis. And then as far as posture goes, same thing. What you were saying is holding the baby, radiating pain through the shoulders and the neck that comes from nursing. A lot of us round forward to nurse.
Right.
Our abdominals are already weak, so it's going to affect our posture because we've either had a C-section or just by carrying a baby.
Right. Yeah.
Had some rapid weight gain in 9 months, and so our body is completely shifted and off. And I keep losing my thoughts. What the heck?
Yeah, that's okay. The one thing I do want to say, though, is, in terms of those alignment issues and looking at the skeleton and what happens, when you're carrying your baby on one hip and all of that is, that's normal. We have to do it sometimes. Yeah. But the thing to know is how to counter that, at the end of your day. Some stretches to do to take you in the opposite direction or to balance you out. Especially, again, if you're a breastfeeding mom and everything's loose and you're chronically getting into this malalignment, your body's going to always take the path of least resistance, and you can create a lot of instability through the shoulders, through your low back, through the pelvis, and the pubic joint too. So, it's just about kind of finding that balance afterwards. You have to do certain things in life. You want to avoid them as much as you can, keep your baby to center. But of course, sometimes we need to hold the baby and do things, with the other hand. But if we could get information to people on how to counter that and balance it out. And even in a Pilates class, I just had a patient in yesterday who her baby's 9 months now, and she came in, actually she had a wrist issue and then an SI joint issue because she decided, and she's doing Pilates certification actually at Core where you did yours.
Yeah.
So she took anatomy and clay and messed up her wrist, because everything's really lax too. So that's a lot of sculpting, with clay. And then I'm not sure what happened, but she decided because of her wrist, her right wrist, she decided then to carry her baby on the other side. So it totally threw her off, and she started having sharp shooting pain going down her inner thigh, and just everything off, and she's still breastfeeding. So first thing we do is look at her pelvis. Pelvis is malaligned, and that happens a lot. So we do that a lot, stabilizing the pelvis. She's doing Pilates certification. So she's doing a lot of, typically in Pilates, you start with your double leg work, and then you go into single leg work. Well, what I advised her to do is after that single leg work, and then you do the core and you do your prone and all of those other exercises, is then to balance yourself out because her pelvis is loose. Go back to being supine, laying on your back, do double leg work, do a little ball squeeze to balance out her pubic bone, and just end with double leg, little ball squeeze, and some bridges to just balance herself out after doing that kind of reciprocal, motion that we do in Pilates, which is great. It's just about balancing yourself back out. Yeah. So that's just an example of, just simple things that make a huge difference, And unfortunately, a lot of moms, I think, and then so what happens then later on down the road? So mom is happy with her little bundle. Yeah, I can't go on the trampoline with my kids without wearing a pad, or I can't leave and go anywhere without wearing a pad. I'm leaking. When I cough or sneeze or laugh. Yeah. And then what happens is then I get the woman who is postmenopausal, in their 60s, even 70s, some in their late 50s, who then are starting to prolapse. Maybe they used to do their Kegels. Some of them weren't doing their Kegels properly. And then there's just that natural atrophy that starts to occur as we age. Yep. Usually these women didn't even know what a prolapse, that was even possible. They start to look down between their legs and they see, their vaginal wall hanging out. And really what it is, it's either their bladder or their rectum descending down into their vagina. So that's another, we don't treat we do help with that in terms of positioning on the reformer or on another apparatus that we use so that the pelvis is a little bit higher, just to help with the prolapse when they're doing their pelvic floor strengthening and doing lower extremity leg exercises. But for that, you do need to go to a specialist, a physical therapist that even before that, a physical therapist that specializes in urinary incontinence, fecal incontinence, pelvic pain, that kind of thing. But so that's the progression, of, the mom that hasn't addressed all of these issues. It comes up, even further down the line. Yeah. Other things that we see too that attribute to low back pain and orthopedic issues are scar tissue that develops from abdominal surgery with a C-section. Also, hysterectomy, ovary, removing of the ovary, or even an ovarian cyst, those types of things can produce a lot of scar tissue, and you'll get shooting pain that goes down the leg. You'll get low back pain. It can present in a lot of different ways. Mm-hmm. So with that, that's a deeper issue, and for that, you'd want to. There are therapists that specialize in what's called visceral manipulation, and they can actually affect some of that scar tissue without you having to go back in and have. If you go back in and have scar tissue removed, you're still going to build up more scar tissue. Unless it's a case where your uterus and your bladder can adhere together, and that can give you bladder issues. So there's a lot to this, and I like that you're doing this just to get the word out, because women, as we talked about before, Natalie, don't talk about, especially if they have a prolapse. No one wants to talk about having to wear a pad or leaking and things like that. And, and then low back pain, we'll talk about that. But a lot of times it stems from all of these other issues that weren't taken care of, early on.
Yeah. Yeah. And it's funny. It's like we said, no, I just think women aren't aware that that's the case, that can happen. And it's just a matter of getting the word out and educating women that it does happen. It can be common. It's okay to talk about it. It finally clicked one day when my client came in and said, and I think I even wrote about this, that she took her kids to a trampoline park and she got on the trampoline, and the first jump, she completely wet herself and she had to leave and go change. And I was just thinking to myself, okay, I know I've heard this similar story before, and it finally it clicked. And I'm like, this has got to be common, but nobody wants to talk about it. And I'm part of this group, this VBAC group online as well. And there was a discussion that kind of got a little bit heated about this particular subject. One woman, because it's, there's such a debate about whether, about C-sections and being forced into C-sections. So people get really heated about that. Totally understand. But one gal's thought was, why would you even have a vaginal delivery? Why don't you just have a C-section? Because down the line, you're going to lose everything. Everything's going to fall out, like your uterus and your vagina and everything. And so women were going back and forth saying, oh, really? Well, what about my grandmother who had 10 children? Her uterus didn't fall. And what about the women who had 14 children? And they just kept going back and forth. And it was just interesting that that they, I'm sure whose grandmother's going to tell you, and whose mother might.
That's a consideration too. Yeah. A lot of times, women have endured a lot. Women do endure a lot in terms of, prolapse and things like that. Typically your grandmother's not going to let you know about that. And a lot of times, maybe did grandma have a lot of low back pain? Did grandma have orthopedic issues? Did her gait start to fail, after a while? Was she wearing diapers?
Yeah.
Well, those are those signs. I'm not a proponent. Everyone has to make their own decisions. You weigh your pros and cons and, educate yourself. That's the thing, is just to really educate yourself and make your own choices. And I really believe in not passing judgment on other people's choices.
Yeah. Oh, totally. Yeah. Totally. And I did chime in and say it can happen either way. C-section or vaginal delivery, but not to worry.
Yeah.
Do something about it, and it doesn't happen to everybody.
Right. And as I told my story today, I'm thinking, people could be listening to this and say, well, why didn't she try and have, why did she have 3 C-sections? And, first one, it was absolutely necessary. Baby's way too big. He was huge and never dropped. I never dilated. Water broke. And then the second one waited, at least 2 weeks past my due date, and just nothing happened. So that was another C-section. Third one, it was actually good. It was really good and life-saving procedure that I had a C-section, because by the third one, the previous incision on my uterus was already thinning out and coming apart. So if I had tried to push, my doctor said that there was a really high chance that my uterus could have ruptured had I tried to do a vaginal birth. And that's just my individual case. And so,
all individual. It really is. It's individual.
Is.
And then you're, between you and your doctor and what you figure out.
Right.
And then for me with the twins, that's what I was told, is that with twins, you pretty much have to have a cesarean.
Oh.
And I think because the girls were so tiny that they were concerned about them coming through through the vaginal canal. But yeah. So, and then with Ava, they didn't want to do a VBAC.
Yeah.
Because of those, all the concerns. So,
right.
So I would love to hear too about when we spoke before, you mentioned your hysterectomy.
Oh, right.
And then just going back down to the pelvic floor muscles and just what a general idea of what happens after a vaginal delivery with those pelvic floor muscles. I think, I forget if you and I were talking about this or not, but the picture I have in my mind is the pelvic floor kind of coming together as like a baby onesie.
Right.
And then as we deliver, it just kind of expands and expands and expands, which can then lead to the incontinence happening, right? Because of our
right. It's a downward pressure. I actually have a little diagram here. Yeah, just to show you the difference. And obviously, vaginal childbirth, is natural, and our body is made to accommodate that. But there's just a huge downward force and pressure. So I'll show you this. On the right hand side is just your vaginal, your pelvic floor and your rectum vaginal opening, just normal before the baby comes out.
I can't see it for some reason.
I'm going to show you in a moment.
Okay,
and then the left side is the baby, actually, because I have to bring this up. So can you see that?
Yes. Say it again now while I'm looking at it.
So the right side,
yes.
That's just normal alignment of pelvic floor, vagina, rectum, urethra. And then the left side is the baby's head. Do you see the baby's head? So this baby, though, this is as if you were laying down on your back. So you can see there's a pubic joint at the top. And so if the baby's head is actually facing down, the occiput, the back of the baby's head is pushing up. So can you see all of that downward pressure? So it's just like a downward pressure and a stretching of those pelvic floor muscles. So that's natural, but you really need to work them and exercise them, obviously, afterwards, and actually immediately afterwards. But what can happen, and I'm going to show you another picture of the pelvic diaphragm. So I have highlighted on the left-hand side, there's a piece of connective tissue. It's actually a ligament there. And that can rupture and tear during a vaginal delivery. Can you see that here on the side? Yeah. So when that happens, everything kind of goes askew, and that type of tear can lead to incontinence, not being able to even contract your pelvic floor. But, those are just docs work with that all of the time, those issues. You get an episiotomy if you get tears, all of those things. But so prolapse can happen, eventually if you don't strengthen. And obviously, but the most common thing is urinary incontinence. Prolapse occurs, later on in life, especially if you have a life with a lot of constipation. We all want to keep regular because it's, if you're finding that you're sitting on the toilet and you're pushing down, even if you've had C-sections, but you're pushing down all of the time, that also gives a lot of, anything that causes a lot of excessive intra-abdominal pressure is going to potentially weaken that pelvic floor and stress the pelvic floor. Also, so then with hysterectomies as well, even after you've given birth and you've had all of your children, it used to be commonplace to have a hysterectomy. Oh, you don't need those organs anymore. Well, now we know better. We know that we need those organs for hormonal support, even after menopause, but also for structural support. So the uterus is there and as a structural support too. So, sometimes we have to have them removed. I had to have mine removed. But what I did, though, was because of my profession, I know that keeping your cervix and your uterus will help to keep that bladder from descending down, or your rectum from descending down and causing a prolapse. So what I did with my doc is I bargained for parts. I have a really great gynecologist, but I met with her at least 4 times before my surgery and said, I have some concerns. I don't want to develop a prolapse after having hysterectomy. And I had to have this because I had hemorrhoids, and one in particular that was pressing on a nerve and just shooting pain down my left leg. So wasn't a good situation. At that point, I was really far from menopause, so it was going to be a long time before any chance of the fibroids shrinking, which typically happens after menopause. So anyways, one of my concerns was not being able to have an orgasm. I know that's not the topic of conversation here, but those are things you want to consider. Yeah. Uterine contractions for some women are a really big part of orgasm as well. So there's that aspect. There's also just that structural support. So I had my doctor promise me, she opens me up, sees my uterus, and if she sees that she can just take a part of it, and keep the rest, please do. Or if you open it up, it just looks beautiful and there's a mistake on the ultrasound, because ultrasounds aren't always accurate, what they're seeing until they go in and see, then please leave it. So we did. She's never done it before. And this is a really great gun. She's really great, but wasn't really even that well versed on like the components of an orgasm. She says, "Are you sure that that's involved?" And I went back and studied, and absolutely, that's part of the deal.
I had no idea.
Yeah. So you're like, uh-oh. Part two.
Part two, my friend.
Part two, yeah. So she went in, took out just the upper dome of the uterus, left the bottom part. Now, this is just in my case. There are other reasons for hysterectomy, like excessive bleeding, things like that. It's all case-by-case scenario. Mine, I didn't have the excessive bleeding and menstrual pain and cramps associated with fibroids. I just had it was just about the location of the fibroid pressing on a nerve. Got it. And then also there was a big cyst on my left ovary as well that she removed. So did that, recovered really well. But then what happened is 2 years later, the cyst grew back on my left ovary. And to my surprise, and then so I went back in and she was going to decide whether or not just to take that ovary and just make sure it wasn't anything else. It was fine, benign cyst. But I have pictures of it too. I have her take pictures. I just wanted to see what is in there. And the amount of scar tissue from that hysterectomy, it wasn't the cyst at all that was causing my symptoms. It was the scar tissue.
Oh, wow.
It was like a big, huge, it looked like a muscle. It was a big, huge band that extended from my pelvis all the way up to kind of attaching to my diaphragm.
Mm-hmm. Wow.
It was huge, just a big, wide band. And so got rid of that, and then that took care of my pain. So what I'm doing now is just, making sure that I kind of, you can only do so much about scar tissue, but then this is where that visceral manipulation comes in, and there are therapists that specialize in that. So hopefully I won't need to do that, but if I do, it's good to know there are options. I wouldn't go back in to have surgery just for scar tissue. I would do, yeah.
Yeah, I've seen pictures of scar tissue too, and they just look intertwined within the intestines and stuff. This is a picture. There's a C-section that was just kind of like really intertwined.
Right.
Yeah, that's really interesting. I love hearing that. Thank you for sharing about your personal history.
My personal experience. Yeah.
I appreciate that. So I would like to just quickly go over some exercises for women that can, or muscle groups. Let's talk muscle groups, because it's more than just Kegels, right? For strengthening the pelvic floor, it's for supporting the pelvis anyway, which is I always tell my clients abdominals, glutes, and then of course the pelvic floor muscles or pelvic floor exercises.
Okay. So it's really good though to be able to practice. Probably would want to start, definitely laying down, but it's good to practice doing Kegels or pelvic floor muscle contractions or strengthening without actually, isolating them on their own, without contracting the glutes. And also, it's just as important to relax them as it is to contract them. So you want to contract pelvic floor muscles, hold 10 seconds, and then completely relax them for 10 seconds. So, doing that off and on, 10 repetitions, you want to do it at least three times a day.
Okay.
Morning, noon, and night, or just get into a rhythm with it. And then from there, say you're not able to contract, this is just specifically for pelvic floor. You're not in touch with your pelvic floor, then you can use the glutes and also your inner thigh muscles, your adductors, to contract to help to engage pelvic floor. So there's like an overflow that occurs if you contract glutes, and that's where I was talking about earlier, where I gave my client the little gentle ball squeeze and a bridge.
Yes.
That will get your pelvic floor to lift just, automatically. And then if you can do that and contract pelvic floor, and then just gradually try to feed into that pelvic floor system. When you contract your pelvic floor, your transversus abdominis automatically will contract. And that's that wraparound muscle. I call it your natural back brace. Your core set, your natural corset that wraps around the waist, muscles, and then they just squeeze in this way. That contracts automatically with pelvic floor. Did I answer your question?
Yes, that's great. I'm picturing all of this. So I'm thinking the pelvic tucks with the ball, and then the corset tightening and breathing alone. I tell my clients that just the breathing exercise that we learn in Pilates training alone, just the shushing sound and feeling the waist shrink in, like you said, like the corset, those alone will strengthen the abdominals.
Right.
And which is amazing, because who knew that just breathing could strengthen your muscles, right?
Right, yeah.
And clients are always amazed by that when they can feel their muscles engaging with that.
Yeah, the right muscles and not what you call your secondary muscles up into the chest and neck area. The other thing I wanted to mention too, though, about pelvic floor contractions, and then just even cueing for pelvic floor contractions, you want to make sure that, what I'll start with is, there have been a lot of studies done comparing cues for pelvic floor contractions. So people like yourself and I who, cue for that. And what they've shown is if you give the cue of contract your pelvic floor like you're trying to stop the flow of urine, for a lot of us that works. But for a lot of people, they end up actually bearing down instead of drawing up and in. Yeah. And that can actually cause a prolapse over a long period of time or make a condition even worse. And then they found like the best cues are to stop the flow of gas. So contract your muscles like you're trying to keep yourself from expelling gas. And the reason for that is because most of the strongest attachments of the pelvic floor are actually toward the back end, toward the anus, and that's where the most innervation is too. So meaning nerve endings that supply those muscles and get those muscles to contract. Yeah. So just a thought.
That's a good one. Yeah.
Yeah.
Because it is a tough one, and that's what I'll say is pretend if you have to stop the flow of urine, and then they will want to clench,
yeah,
and then tuck their pelvis as well with that.
Right.
Not necessarily an outward movement, but it can be to help. But more an internal contraction. Okay. So is there anything else you wanted to add to that, to the pelvic floor or abdominals or anything like that?
Not that I can think of.
Okay. So I just wanted to go over, we weren't really discussing diastasis, but we had one question come in, and I will read that to you, and we can just briefly discuss this. let me find it. I had it right here. Okay, here we go. So this gal sent a message in saying that she is 4 weeks postpartum, and she had an unplanned C-section, and she also discovered that she has a 4-finger with diastasis recti.
Mm-hmm.
So she was saying that she purchased an abdominal binder previous to the birth, and and found it beneficial for her C-section.
Mm-hmm.
She wore it pretty consistently for 2 to 4 weeks postpartum. It helped with her initial C-section. Okay. She says, now it's a bit big. I have a pretty big diastasis recti, about 4 fingers. Will purchasing a second binder really aid in helping my diastasis, or is physical rehab really the only effective solution?
Yeah, well, she definitely wants to go for, rehab for sure. So she can, because ultimately what she wants to do is strengthen her core. So if she were to use the binder, all of the time consistently, she could actually start to atrophy more, and just her core would start to get more and more weak.
Mm-hmm.
What I would advise though is, if she's going to ever have to lift heavy loads and, things like that are going to give her a lot of intra-abdominal pressure, to go ahead and use the binder just for short periods of time, but not to use it, 24/7, because it's like using those, those back belts or those back braces. You become reliant on those, and then, all of your muscles get weaker, and then it'll actually make it worse. Another thing too is when she does do abdominal exercises, not to do crunches or sit-ups, things that are going to make that, that separation even more prominent.
Yeah.
But I would definitely seek the advice, or at least a consultation with someone who can show her the appropriate exercises to strengthen her core without increasing that. And she's only 4, did you say 4 months?
4 weeks.
4 weeks, yeah.
4 weeks.
So there's a lot of potential for that to, for that to minimize. But I just wouldn't become, what do you call it, dependent on the binder.
Yeah.
She wants to kind of be on and off of it.
Good.
Yeah,
that's perfect. Yeah, I did one, and I'll send it out to her too. I did 2 articles with some, one for really new moms, or, beginning exercises for moms with diastasis. And then I did another one with advanced exercises. So I'll be able to send that to her.
Articles.
Yeah, I'll send you my articles.
Yes.
So I can't thank you enough for sharing everything and giving us all of your knowledge and insight. I loved it. It's always an education for me too. So thank you so much for hanging out and chit chat.
Yeah, you're welcome. It's been a pleasure, and I'm happy to have the opportunity to just share some of this information that we women just don't talk about often enough. So
yes, thank you.
You're doing good stuff.
So Dr. Natalie can be found in Calabasas, California, if anyone's living in that area and you need some amazing physical therapy help.
or Pilates.
Or Pilates or yoga. And her office is called Symmetry Physical Therapy and Pilates, correct?
Yes.
And you can find her at mysymmetrypt.com, correct?
Yes.
Awesome. I love it.
Great. Thank you.
Thank you so much, Natalie. And I will talk to you soon.
Okay. Talk to you soon.
Bye.
Bye.